Good, good morning. So today's class, we will talk about the complications of local anesthesia. So broadly, again, local complications can be local and systemic, and local complications are due to needle breakage, persistent anesthesia or paresthesia, that is, the anesthetic effect is prolonged or sometimes even permanent. Facial nerve paralysis, injury to the facial nerve that causes paralysis of the muscles of the face. Trismus, inability to open the mouth. Soft tissue injuries, hematoma, and pain on injection. So again, local, the other complications can be burning on injection. As the solution is deposited, the patient feels burning sensation. Infection following the local anesthetic injection can be due to hematoma getting infected. Edema, sloughing of the tissues, and that is mainly due to the destruction of the tissue because of the blood supply being cut off from that area. Now the blood supply is cut off because possibly there is a chance of increased vasoconstrictor in that region that causes vasoconstriction and the blood supply to be cut off. And post-anesthetic intraoral lesions also can be found in certain individuals. Now we'll deal with each separately. So needle breakage causes can be bending of the needle before injection. Some clinicians have a tendency to bend the needle to get a better angulation or some reasons, and that can potentially cause breakage. Small gauge needles especially are very prone to fractures and some manufacturing defect. So prevention and management is to be careful. Good quality needles should be purchased, and 26 gauge or 28 gauge needles are generally used. Bending should be avoided. Persistent anesthesia or paresthesia causes can be trauma to the nerve sheath because the needle can pierce the nerve sheath and cause trauma. Contaminated solution that can again cause damage to the surrounding areas. Hemorrhage, bleeding, or the hemorrhage that is caused by the needle tip entering a blood vessel. Local anesthesia can be neurotoxic sometimes, so directly that will affect the nerve. So prevention is again, or how do you manage it, is to make sure that you aspirate properly and avoid contaminated solution and make sure there is no injury to the nerve or vessel. Facial nerve paralysis, other causes can be injection into the parotid capsule. Echinocey technique is chances of paralysis of the facial nerve side. Spread of solution superficially in the inferior, the infraorbital block, superficial spread of the solution occurs. Trismus can be caused due to trauma to the muscles or vessels in infratemporal fossa. Alcohol contaminated local anesthesia, mycotoxicity of local anesthesia, hemorrhage, infection, and repeated injections. So these are the causes that can that bring about trismus. All right. So again, prevention of trismus. You can use sharp, sterile, disposable needles. Sharp needles used once, because once a needle is used, we talked about in another class about the needle barb being formed when the needle tip is touching any bone or hard tissue. So use it only once. Use aseptic technique, practice atraumatic technique, and avoid repeated injections. So inserting the needle into the same muscle repeatedly can bring about uh, bleeding into the muscle that can cause, especially the medial cervical, can cause trismus. Use minimum effective volume of local anesthesia. What is required? That is all is necessary. Don't over infiltrate. Or how do you manage it? Heat warm saline, with you can use warm saline and mouth gargle, and analgesics can be given. And for 48 hours, then antibiotics. So initially, just wait for about 48 hours, see whether it resolves by itself. But if not, then you might have to start on antibiotics. Okay. So soft tissue injuries, that's another complication of the local anesthesia. The causes of soft tissue anesthesia last longer than pulpal anesthesia. So these patients will, will inadvertently chew on their lips, or seen in children and mentally disabled adults, because the lip is also anesthetized when you're giving a inferior block example. And if they're not careful, that they have to be, the adults have to make sure that the children and mentally disabled people do not chew on their lips, because it is numb. Because once the anesthesia wears off, this soft tissue injury that is caused by the patient by itself will be more painful to manage. So management is, so prevention is the first thing to be remembered. Then how do you manage it? Analgesics, antibiotics, warm saline rinses, and Vaseline to the lip. Another complication is a hematoma after local anesthesia. The causes is a puncture of vessels, posterior superior alveolar artery and inferior alveolar mental nerve. All these are very higher chance of injury to the vessel itself due to needle piercing. So prevention is a knowledge of the anatomy. You need to know where the nerve will lie and make sure that our needle tip is far away from the nerve. Use of short needles, especially for posterior superior alveolar. Minimize number of needle penetration. So again, that is important. How you would treat the soft tissue. Unnecessary penetration has to be removed. Short needles. You don't need to use long needles for posterior superior alveolar block, because that can go into the pterygoid plexus of veins that cause hematoma. So avoid all that. Management is apply. Once you have hematoma, how do you manage it? Apply pressure, ice, and over a period of time. Antibiotic is questionable. If it is needed after 48 hours, you might have to give antibiotics so that the blood clot, which is the hematoma, doesn't get infected. Pain on injection, that's another complication, because some patients are not very comfortable having dental treatment, because one reason is the pain on injection. And what are the causes? Careless technique. If you're not careful, do not consider the patient important, and you just use the needle and pierce it, and just with carelessness, that can cause a lot of pain to the patient. You need to be aware of that. Needle is dull due to multiple penetration. Multiple times the needle enters into soft tissue, hit a bone. You'll find that you can even hear that tearing and kind of feel, or you can feel the tearing of the structures during when the needle is blunted. Rapid deposition of local anesthesia is the most common reason why patient complains of pain. So it has to be 2 ml of local anesthesia should be deposited over a period of maybe a minute or so. And needle with barbs, we have explained that earlier. Prevention, how do you prevent all these, the pain on injection? Proper technique. Sharp needles to be used. Use topical on the mucosa before penetration. Slow injection and correct the temperature of the local anesthetic. Warm it up if you are in a cold climate. Burning on injection is the cause can be due to acidic pH of the local anesthesia. Rapid injection, contamination of local anesthesia, and too warm solutions. Sometimes, especially in cold climates, the vial or the cartridge, local anesthetic cartridges are sometimes heated in a cold, warm water bath. And if it becomes too hot, then again, it can cause burning. And prevention is, again, slow injection over a period of time. 2 ml, it takes about a minute or so. Solution is made sure is in the room temperature. And if there is if the pH is acidic, alkalinize the solution. Another complication is infection. The infection, the causes can be contamination of the needle, injecting into an area of infection that is already infected. So if you pass through an area of infection and the needle enters a different part, again, that area can get infected. So that's due to contamination. So prevention is use sterile needles, handle needle with care, and if there is infection, always prescribe antibiotics. Another complication the patient experiences edema. Edema can be caused due to trauma during the injection, infection, allergy like angioedema or local anesthetic agent like ester LAs, and hemorrhage and hereditary angioedema. That's again a particular condition where you have swelling, a large swelling of the upper and lower limbs, and that is seen in some individuals, hereditary, due to trauma or any stress related also. So these are the causes of edema and can be controlled depending upon the cause. Sloughing of tissues is caused by epithelial discomation, sterile abscess due to prolonged ischemia. So there is a sterile abscess formation due to prolonged ischemia, and this ischemia is due to the probably due to vasoconstriction of that region. So a lot of the vasoconstrictor agent in a small region can cause abscess, sterile abscess. Prevention is a use of topical so that the epithelial discomation doesn't occur. Do not use topical. Do not use overly concentrated vasoconstrictor and symptomatic manage. And rare instances of post-anesthetic intraoral lesions are seen, and that is mostly due to the stress involved. Causes the most common lesions are recurrent aphthous stomatitis. Aphthous ulcers can form after a dental procedure due to the injection, the stress of the injection. Herpes simplex, the HSV1 can be. You get a fresh crop of this infection. Management is to reassure the patient, calm the patient, reduce the stress. Topical anesthetics can be used like viscous lidocaine, diphenhydramine, or base and tannic acid can be applied in that region. Thank you.